Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over the bones of the pelvis. And Skinny Bones Jones is going to graciously help us with this task. So for your anatomy and physiology class, you may be required to know all these little bones of the pelvis. So in this video, I'm going to go over those for you, and then after you watch the video, be sure to go to my website, RegisteredNurseRN.com, and take the quiz about the pelvis bones. And a link should be popping up, so you can click that and take that after you watch this video. So let's get started. Okay, we have Skinny Bones Jones's pelvic region right here. And your pelvic region, it houses your reproductive organs and the end of the digestive system. And the pelvic is where your femur, which is this big bone, which is the largest bone in the body, meets in the acetabulum and forms the upper part of the leg. Now, the pelvic region can be divided into 8 parts, and I like to think of it these 8 parts because everything else fits along if you know these key 8 parts, which we're going to go in detail, but let me go over them real fast. We have the sacrum, which is back here. You have the ilium, you have the ischium, you have the pubic bone, the pubic synthesis, the acetabulum, which is this little socket in here, the obturator foramen, and then the coccyx bone, which is the tailbone. Now first let's go over the ilium. The ilium is located right here, and this is the largest bone of the pelvis. And from the ilium you have what's called an iliac crest. And on this crest you have the posterior, let me turn him around for you. You have the posterior superior iliac spine. You remember that because posterior means back, superior means up. So there's the spine of the iliac crest. And then you have the anterior superior iliac spine, which is right here. And what happens with these is that muscles and ligaments attach to these areas. And the iliac spine, like I said, has 4 attachment points, and they are the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior, and the posterior inferior. So there's 4 points where these muscles and ligaments attach. Now after that, you have what's called the sacroiliac joint, and this is right here between the sacrum and the ilium of the pelvis. Now it's this little crease right here, and what this is, it's a joint, it's a very strong joint, and it helps you with weight bearing. It's very important with that. And after that we have the acetabulum, which if this skeleton's little femur was removed, you would see a nice little socket right in there, and it's just like a little hole where your femur head fits into, and it allows you to move your hip, and it's a socket bone. Then you have the pubis, and the pubis is this bone right here. It's below the ilium, and your pubis's function, it forms part of the acetabulum and the hip joint, and it provides protection to organs such as the urinary organs and the reproductive organs. And located below the pubis is called the obturator foramen. It's this hole right here. Now remember this by foramen. The word foramen means a hole opening into a bone. So whenever you see that, think of that. And the obturator foramen is created by the ischium, which we'll go over here in a second, and the pubis, and it allows nerves and blood vessels to pass through here. And below that is the ischium, and this forms the lower and back part of the hip bone, and it's this little area right below that, and it's situated behind the pubis, and it just bends back a little bit. Then in the middle of this, you have what's called the Pubis Synthesis. And this is a joint. It's made of cartilage. And what the function of this little thing is it absorbs shock during walking. And in women, it allows the woman to deliver the baby whenever the baby's coming down through the pelvic canal. And last but not least, we have the Pubic Tubercle. And what this is, it's just this little notch right here. And remember, tubercle is an area that's small and rounded projection, and what it does is it allows the inguinal ligament to attach to it. So your inguinal ligament's there, and just remember on the body, you know how you have the inguinal area? It's located on your body in that, and just remember that the inguinal ligament will attach to that part. So that's the big thing about that. Now that is everything about the pelvis, and I hope that helped you out, and that was just a quick overview. Okay, there you have it. That was the bones of the pelvis. Now go to my website, registerednurserian.com, and take the quiz and see how well you understood that material. And thank you so much for watching, and please check out my other teaching videos for anatomy and physiology.